Good evening, everyone. My name is Crystal Regan, and I'm the Chief Education Officer at the North Carolina Museum of History. Thank you so much for joining us for our third NC Community Class program. We created this series with the goal of educating and engaging all citizens on the historical topics specifically relevant to underrepresented communities. Tonight's program is entitled Black Maternal Health and the History of Eugenics in North Carolina. This is a rescheduled class from our virtual African American Cultural Festival, and we are so glad to have Dr. Harper with us tonight. But before I introduce her, just a few reminders. Please enter your questions in our chat. Our chat will be monitored, and we hope to get to a few of them during the question and answer session of the program. Please make sure that your comments and your questions are relevant and respectful. And we also ask that you continue to look at our events page for upcoming programs here at the museum, and I'll talk a little bit about them at the end. Now on to Dr. Harper. Dr. Kimberly Harper earned a BA in English from North Carolina Agricultural and Technical State University, has a master's in technical and scientific communication, and a PhD in technical and professional discourse from East Carolina University. Currently, Dr. Harper is an assistant professor of English at her alma mater, mine as well, North Carolina A&T State University. Her research examines social justice, Black rhetoric of health communication, and community ethos. She is also heavily interested in mental health and hip hop discourse. Her research has appeared in Reflections, a journal of community engaged writing and rhetoric, the Western Journal of Black Studies Connections, an international professional communication journal, and writing networks for social justice. Dr. Harper recently published The Ethos of Black Motherhood, which explores America's current Black maternal health crisis through the lens of written language. She hosts a monthly podcast called The Space of Grace that focuses on reproductive justice and Black maternal health. Dr. Harper is currently researching and writing about the ancestral memory and quilting in the African American community. You can follow her on Twitter, and we will provide a post for you on that in our chat. Welcome, Dr. Harper, and please take it away.
Thank you, Crystal. I'm so excited to be here today. I'm just overjoyed because, we had a technology hiccup the last time, and so I'm glad to be back. I'd like to thank Miss Naomi Feast for connecting me with the wonderful staff at the North Carolina Museum of History. I'd like to also thank those who have supported and sustained my journey into motherhood. So after my immediate family, I've also been blessed with a network of women and men who've rallied behind me. They've encouraged me to pursue my PhD, watched my children, read drafts, and lifted me when I was down. And I'm here this evening because of that community of support, and I have to acknowledge that. And finally, I'd like to thank you, the participants, for sharing your evening with me, especially those of you who came out a month ago and came back tonight. So I'm so grateful. Before I get started, I'd also like to share that I use the term Black and African American interchangeably, and I'm defining those terms to mean people who are the descendants of enslaved Africans who were forced into chattel slavery here in the United States of America. And I'm well aware that the term Black is expansive in its meaning, just like the people of the African diaspora are. So today, we will discuss Black maternal health through the lens of reproductive justice. And that's going to afford us to have a discussion about the history of eugenics here in North Carolina, as well as reproductive justice. We are saying farewell to Black History Month, and we are on the cusp of Women's History Month. So it's fitting that we start this presentation with the Sankofa. The Sankofa is a mystical bird that flies forward while looking backward with an egg in its mouth, and that egg symbolizes the future. It is an Akan symbol from the African nation of Ghana and can be found in the Twi and Fanti languages, and it means to go back and get. And so the Sankofa bird reminds us that we must continue to move forward as we remember our past, while at the same time planting a seed for future generations. So in essence, the Sankofa is a wonderful representation of the Black maternal health conversations that we're hearing now, because we have to look to our past and understand how we got here, deal with the present moment, and then put something in place for those future generations. And that's what I hope to discuss tonight. We all know the Black Lives Matter movement has been important to our nation. And what I'm suggesting though tonight here, and just bear with me, go with me, is that Black lives in fact do not matter, because the source of Black life, the Black womb, does not matter. Historically, Black bodies have only counted if they added value to the American economy. So if you think about chattel slavery, sharecropping, the peonage system, and the prison industrial complex, you find that Black and brown bodies were continually over-policed and placed into a system that essentially creates a permanent financial underclass. And Michelle Alexander writes about this at length in her book, The New Jim Crow. It came out a couple of years ago. But when we talk specifically about Black women and we look at their experiences in America, their value has always been attached to reproductive control and sexually controlling images. And these images have been used to justify the poor treatment that Black women, Black families, and communities receive ultimately. So Black feminist scholars have put together wonderful scholarship that focuses on how Black women operate in the world, in America. And there's something called the bad Black mother trope, and it includes these images. When a Black woman was considered property during chattel slavery, she represented a monetary value for slaveholders. And so she was either a mammy or a breeder woman. Mammy was expected to take care of white people's families at the expense of her own, and breeder woman was expected to have as many children as she could humanly possible. And if you think about it, Black women really supported an entire, workforce in this country during chattel slavery. They gave birth to an entire nation of people, if you will, who went on to work in chattel slavery. When she was no longer property, she became a matriarch who was contextualized as someone who emasculated her man. She could not conform to the system of patriarchy, which is problematic in its own way, but we don't have time to talk about that tonight at depth. And she was, because she emasculated her man, supposedly, she was left to raise her children alone. But that doesn't work, because Black families have been were torn apart during chattel slavery, and now they're free, and they're placing a system of patriarchy on a broken family structure, right? So when the government wanted to blame somebody for the growing price of public aid, the Black woman was then recast as the welfare queen, and later teen moms, right? So welfare queens were considered women who couldn't control their reproductive choices. They had child after child, which resulted in her needing public assistance. And ultimately, welfare queens had teenage daughters who would then repeat the steps of what their mothers did. But we have to keep in mind that the welfare queen and teen mothers were born out of cuts to social programs in our country. And so once the Reagan era hit and you had budget cuts that ended social programs, like I said, Black girls were now blamed for putting an additional financial burden on society. And that's when we saw the term teen mother enter into our lexicon, again, describing Black families and mothers. Jezebel and the B word were used to sexualize Black women. Black women have always been hypersexualized, but these terms in particular and images were used to justify the sexual assault that Black women suffered from during chattel slavery and even after that. So she's a woman who can't control her sexual appetite, and she's willing to have sex with any and everybody, and therefore she's fair game, right? So these two images were also detrimental to Black women. And finally, crack. Crack hit the 90s really hard, late 80s, early 90s. And we saw terms like crack babies, crack mamas enter into our lexicon. And the treatment that Black mothers who had a substance abuse problem with crack, they were treated totally different than what you see now with the opioid crisis. And I suggest that's because the opioid crisis has reached middle America, and you see white women struggling with addiction. And so the tone has softened, and the approach to treatment and the expansion of treatment options are now available. When Black women were being arrested and um, placed in jail while they were pregnant and in the middle of an addiction, their children were taken away from them. But now you see here today that a lot of women have the opportunity for recovery programs rather than jail. And so there's a difference between how white motherhood and Black motherhood are viewed in our country. And so when we think about these images, I said to myself, okay, if Black women carry these images with them and they kind of change over time, but always to suit like a political agenda, how is that affecting the Black maternal health crisis that we see now? And so after having my own birth trauma, I started researching diligently what motherhood looked like and how it was visually articulated, and then also the written words associated with it. Now, we know we have a current Black maternal health crisis in our nation. We have lawmakers like Representative Alma Adams, Lauren Underwood, working hard to get funding for Black maternal health care. And maternal mortality is defined as the number of women who die from pregnancy-related causes for every 100,000 live births. And we've heard the statistic very often now in the news that Black women are 3 to 4 more times likely to experience a pregnancy-related death or a preventable maternal death, more so than white women, regardless of her education, her access to health care, and even her financial situation. So you hear about Serena Williams, who understood her own body and knew that she suffered from blood clots or embolism. And she had to fight with the medical staff to get the care that she needed. You hear about rapper Remy Ma, who was rushed back to the hospital after giving birth to her child. Dr. Shalon Irvin in Atlanta, she was a CDC, I think she was an epidemiologist, and she died. And I believe she died from a stroke or preeclampsia, I can't remember. And then of course there's Kira Johnson. If you all are familiar with Judge Glenda Hatchett, that was her daughter-in-law who died after having a standard, what we consider standard now, a C-section. And it was planned. She went in and she ended up having some internal bleeding, and the hospital staff ignored her. And when they finally took her back in, it was too late. So Black women are dying at every stage and income and education level. And so this maternal health crisis is something that we have to attend to in order for future generations to have better outcomes. Allison Young of USA Today conducted an in-depth study where she found that 60% of hypertension related strokes and 90% of deaths associated with hemorrhaging could be prevented. So you're basically bleeding out. And that's because staff didn't necessarily know how much blood a woman lost after she gave birth. And so, like I said, I started thinking, like, what's really going on? I'm not a medical professional. I've had 2 children. I have friends who've had kids. And as I started researching more, I started hearing a lot of stories about feeling dismissed when you go into your medical appointments and not being heard. And so as an English major, someone who's interested in the written word, I am centered in technical and professional communication, looking at Black rhetorics of health communication. I started with the visual image. And I found that Black mothers are disassociated from the positive representations of motherhood. And I'm speaking specifically in the broad American landscape. Within the Black community, it's clear that there's a reverence for motherhood and Black mothers and those communities of other mothers who help raise children. But at the national landscape, Black women still carry these negative images with them. So I did a little study. And what I found is that Well, let me just tell you about my study first. So, like I said, I theorize that the medical establishment's poor treatment of Black mothers come from implicit biases rooted in the bad Black mother trope that I just talked about. And so to test this hypothesis, I conducted a critical discourse analysis of pregnancy books. Now, I will say in my experience, when I went to the doctor, I was given pregnancy literature from the medical establishment that showed women of varying ethnic backgrounds. But when I talk about pregnancy literature, I'm talking specifically speaking about the books that are produced by publishers that are adjacent to the medical field. So when a woman finds out she's pregnant, she typically goes and buys a book. And 9 times out of 10, it's a commercially produced book that has maybe a medical professional has consulted with, but it's not like the pamphlets and things that you get when you actually go to your doctor. So there is a difference. I conducted a search using Amazon.com and Barnes and Noble, and I used only the term pregnancy books. If a book gave me a response, I looked for things like pregnancy, postpartum, infertility, nutrition, breastfeeding, gestational diabetes, or books related to raising a child in their first year of life. And I did not include things like pregnancy journals or stories or narratives about someone's pregnancy. And what I found, and we're looking at this slide here, the categories that I used were based on mother, father, mothers and fathers, mother and child, children. And the majority out of 193 book covers, 52 of them featured white mothers. 2 of them featured Black mothers. 11 featured a white mother and child. 38 of them featured white children. So this idea that from a visual perspective, Black mothers don't exist in this broader canon of literature. So I want to show you just a few of the covers that I found. Now, this study was done in 2019. And thanks to the work of people like Sophia Noble, she's written a book called Algorithms of Oppression, Virginia Eubanks, Automating Inequality, people are starting to talk more about the algorithms that code on the back end of technology. So when you do a search, sometimes based on who the programmer is, you're going to get certain results. And so it's changed a little bit. But like I said, all this these images came off of Amazon. And so you can see that the majority of the pictures, like I said in my study, are of white mothers. So based on my research, I offer that cultural gatekeepers like book publishers and some people within the medical establishment constrain the imagery of pregnancy books. And this erasure, coupled with the erroneous assumptions that Black bodies can bear more pain, really turns out to be a deadly mix for Black women who enter into a maternal nursing culture that is heavily influenced by white middle class values, and it's really dangerous. So as I said, okay, well, how can we fix this? I see myself as a scholar activist, someone I want to use my research to affect change in my community. And I came across a theory that I think is just so important for people to know about, and that's reproductive justice. Reproductive justice is a theoretical framework as well as a form of activism. And it was founded by 12 Black women who decided the feminist movement needed to expand their discussion of abortion rights to include rights for health care and services that supported families. And I believe they met in 1993, if I'm correct. And so reproductive justice really gets at the heart of what's going on in communities of color. So the first tenet is the right to raise children in safe and healthy environments. And what that means is you have access to grocery stores in neighborhoods that are not in the middle of a food desert, access to schools that are funded and well-paid teachers. The nation's educators work extremely hard in this country, and the K through 12 educators, they go above and beyond, and we've got to do better by our teachers in this country. I can't say it enough. but I don't want to go down a rabbit hole on that, but we got to do better. Access to safe and affordable housing. There's this erroneous narrative that circulates in our country that people don't want to work because they ask the government for a handout, or they expect the government to support them, when that couldn't be farther from the truth. People are working to take care of their families, but when you have issues with safe and affordable housing, what is one to do? For example, according to the National Low Income Housing Coalition, here in North Carolina, a person would need to earn $16.95 per hour and work 94 hours per week to afford a 2-bedroom apartment. And that does not guarantee that that apartment's in a safe neighborhood. So access to a living wage is so important to families being able to not survive, but thrive, right? Access to affordable childcare. And I don't have this on the slide, but I would be remiss if I did not mention the importance of over-policing in our communities. Today is the anniversary of Trayvon Martin losing his life to a white citizen who saw themselves as a police officer, and it has happened over and over and over again in our country. So I have a right, you have a right, everyone has a right to raise their child in a safe environment, and those individuals should be safe from citizens who see themselves as police, and safe from police officers who are not trained or who do not wish to de-escalate situations in our communities. So in addition to the right to raise children in safe and healthy environments, we have the right not to have children. And let me get to the next slide. The right not to have a child by way of access to contraceptives, access to safe abortion services. So I'm not here to debate whether people are for or against abortion, but what I do believe is that people should have a right to access safe health care, regardless of somebody else's opinions. I guess whatever, but also access to reproductive screening services for men and women. So your mammograms, your pap smears, your prostate exams, and then again, access to, overarching affordable health care. I mean, think about it. We have Medicaid, Medicare, the Affordable Care Act, private health care insurance, and each set comes with its own rules and regulations that can be confusing to anybody, right? So we really need to find a way to streamline our system that allows people to get the medical care that they need. In addition to that, medical care is connected to the living wage. If you have to pay rent, child care, car insurance, all the things that you have to pay in order to live, and you're sick, that's the last thing you're going to attend to until you just can't, not pay attention to your health care. And so people should have a right to affordable health care. And finally, the right to have a child the way you want to. So if you want a midwife, you want a hospital birth, you want a home birth, you want a doula there, people should have a right to those services and those choices. And in addition to that, right to give birth, people should not be forcibly sterilized, right? And so this is where we enter our discussion about the eugenics movement. The term eugenics comes from the Greek word good and origin, and it means good birth, and it involves basically selecting which of humanity gets to reproduce. So basically you're weeding out who can have a baby and who can't have a baby. But then who makes those choices, right? So according to the Justice for Sterilization of the Victims Foundation, eugenics is intentional and selective breeding of humans. And in our country, the criteria for eugenics has been based on mental conditions. And so the language that was used at the time was like calling somebody an imbecile or feeble-minded, people who had a proclivity to criminal behavior. So if you were in and out of trouble, you might be somebody that they would consider for sterilization, and people who engaged in premarital sex, poor people. So if we think about eugenics, right, and we think about race, class, and gender. All those things come together and intersect in a very unique way for people of color in this country. So across race, even though it started out, so they say, they wanted to breed out people with certain hereditary issues, it boiled down to getting rid of Black people, among others, poor white people, immigrants from Eastern European countries at the time. It was also a demonization of physical features associated with people of color or non-white features. If we look at the intersection of class, Dr. Price, Darity, and Sharp introduced into the conversation this idea of surplus population. So you have citizens who are not part of the labor force for whatever reason, then they should not reproduce, because they're not going to have, if they do, they're going to have a child that probably will not then go into the economy. Also across the lines of class, and I mentioned this a moment ago, preventing poor people from reproducing because of their lack of means. And then across gender, punishing women in particular for having premarital sex. I think the statistic is that like 85% of people who were sterilized were women. So that's obviously women were at the top of the list. So the goal was to save America from inferiors reproducing. I just can't even believe this happened in our country, but it did. And there were legitimate organizations that came together to encourage this type of mindset in our country. So the Human Betterment Association, the American Eugenics Association, American Genetics Association, John Harvey Kellogg, founded the Race Betterment Foundation. And yes, I'm talking about Kellogg of the cereal company. And then there's Margaret Sanger. She's a polarizing person in the eugenics discussion because she is the founder of Planned Parenthood. So on the one hand, people say she wanted poor women to have access to birth control so they could control their circumstances and control when and how many children that they had. But she also wrote quite a bit. Much of her writing was in support of eugenics. So out of that, we do have Planned Parenthood, which I believe has provided a great service to women who are uninsured in our community. So what are you going to do? But if we return to the images of Black motherhood, we see how Black families and mothers can be funneled into this eugenics movement because of the perception that they don't add value to America's economy because now they're not working as chattel slavery. So if we look at laws supporting eugenics across the country, eugenics really took hold in the early 1900s, and you see by 1927, close to 30 states had sterilization laws on the books. And so again, that idea of feeble-minded people or someone who had a genetic defect or on welfare really played a role in who was considered a viable option for being sterilized. And here I have a map that shows you, and this is in 1935, exactly how many states actually had laws in effect. And so there's North Carolina right there with everybody else. And the Black states had laws that were pending. So it was a national movement. And when we talk specifically about North Carolina, in 1929, the North Carolina General Assembly legalized involuntary sterilization for a patient or an inmate when it was in the public's interest. In 1937, the General Assembly formally established a eugenics board. And then from 1958 to 1968, that board authorized 2,100 sterilizations across 100 counties in our state. And I've seen different dates. I've seen 74, 76, and 77 when eugenics ended. And so here I have a map I want you all to take a look at with me. And basically you see that Mecklenburg County had the highest rate of sterilizations, right? And I'm in Guilford County, and we had 167. But sterilization happened all over this county, all over the state. And this is from 1946 to 1968. Oop, just a second. So North Carolina, Governor Easley apologized for the sterilization of North Carolina citizens and set aside $10 million in a fund to repay those individuals who had been forced into sterilization. And if you have time and interest, you can look up Elaine Riddick's story. She was instrumental in working towards that policy being passed. And she was 13 years old when she was raped by a family member, and she ended up becoming pregnant. And after she gave birth to her only son, she was sterilized. And so she was unable to have any children anymore. So on top of the trauma of a childhood rape, she then finds out that she's unable to have children. And so I just want you to think about the numbers of people who had their reproductive organs taken away from them, and in essence the opportunity to control the choices that they wanted to make for their life. So whether they wanted to have a family or not, that decision was already made for them by social workers who were in the community, making decisions based off of one's class, one's race, one's gender, or the activities that they engaged in. So eugenics has been something that has gone away, but we have to be very careful of it and think about now how genetics has kind of come back into the conversation we see today with DNA testing, and just keep staying aware of what's happening with the field of genetics in humans, because we know what has happened, but we have to work diligently to prevent anything like this happening again. And I just want to offer some closing thoughts in general. I think it's important that we talk to our children about their reproductive health and help them understand their bodies in the context of health and not just sexual appetites and experiences. If we can teach our children at an early age about those reproductive needs and the things that their bodies are going to go through, we hope that they will be better prepared, right? We need to disclose, especially as Black people, we need to disclose our family history so we can empower other people and other generations. There's some type of stigma, and I don't know why, in our families where we don't want to tell people that we're sick, or we don't want to tell someone what that person may have died of. And if it's hereditary, like breast cancer, or if there's something specific that other people in your family have had, we should share that information so we can help one another. We need to find ways to support parents. We've kind of become disconnected from that idea that it takes a village to raise a child. It's paramount in order to get our children to a place where they can become productive citizens in their communities. And if you know someone who's pregnant, support them in their journey by asking questions, by standing up for them, by going to doctor's appointments with them, by listening to them. If they say, I don't feel good, don't say, oh, go lay down, you'll be okay. Ask more questions to determine and help that person decide, well, maybe I should call the doctor. Because a lot of times, especially with women, we don't want to put a burden on somebody else. But pregnancy, I've heard it described as the closest a living person can come to death without dying, because of the stress it places on the mother's organs, right? And the placenta itself is a whole nother organ that has grown in that body to nourish the child. So we've got to encourage mothers, if they're not feeling well, go to the doctor, go with them, be a voice for them. Do not allow them to be dismissed. For medical professionals, they need to begin to utilize language that empowers rather than marginalizes communities. And they also need to acknowledge the harm and trauma that's been perpetuated in Black communities because of medical practices. People talk about the Tuskegee experiment all the time, but there were radiation experiments on children of color in this country. We have all types of things that have happened. If you look in the history of just what happened during chattel slavery and what Black women endured at the hands of J. Marion Sims and other men who were experimenting on their bodies in the name of science and gynecology, we've got to shift also and take the conversation from Black people don't trust doctors to doctors have perpetuated harm in our communities, and that's why we don't trust and are sometimes hesitant. I think that is a serious shift that needs to happen when we hear journalists and other people talk about our community and medical practices. Again, also, we have to encourage our children to go into the sciences, but we've got to provide support, financial support. We need money. Right. And so then also engage in community-led planning that allows communities to lead their own initiatives. If you are a healthcare professional and you want to go in and help a community, go in with the intention that you're going to listen to them, train them, give them the tools, and then leave them in a position that they can drive that machine without your presence. Your presence might be needed, but you shouldn't be central to the activism taking place. You should be a small part of the plan. And when you walk away, those communities should be able to stand on their own. And here is just my works cited. And if you want to take a look at that, let's see. If you're interested in reproductive justice, Loretta Ross is one of those 13 women. She's a national speaker. She talks about reproductive justice and Black mamas and just fighting for equity. And she's an excellent resource. Patricia Hill Collins, wonderful resource in terms of Black feminism. I borrow a lot of my theory from her and others. Just Black women have done some awesome work. They have given us a litany of research that we can draw on. So here's my book. I have to give a little plug for my book. It came out last year. And so if you're interested in reading more about how ethos, which is like our character, who we are, the image, and what that means when we go into spaces, I encourage you to get it. I have a 30% off coupon here. And I think Allison's going to drop it in the chat box as well. You can connect with me at these areas. And I am an Aggie, so I have to shout out North Carolina A&T. We are having a fabulous program. It's great things going on in Greensboro. We are having a program titled Everyday Use, which is going to focus on quilting and African-American storytelling. But this program is in conjunction with a larger program in Greensboro. So Creative Greensboro, the New Africa Business and Cultural Center, Sankofa Sewing are all coming together to provide youth ages 9 to 17 with a sewing class starting in May. And sewing is wonderful because it's something that you can do and you don't have to sit close to somebody. We're still dealing with COVID, obviously. So we want to give children something to do and then teach them a skill that has kind of gotten away from us. We also have a Master of Arts in English and African American Literature at North Carolina A&T. And so if you're interested in our program, you can give Dr. Hope Jackson a call or send her an email. And we are actually preparing to have a graduate certificate in technical and professional communication, probably maybe the fall or the spring. But so we have great things happening at A&T, and as they say, Aggies do. So I'm so happy for that. And Crystal, that's the end of my presentation. So we can open up the floor and take some questions. And I'm going to get out of here and stop my slide show, maybe.
Okay. All right. So thank you so much, Dr. Harper. So the next 15 to 20 minutes before I give some closing remarks, I want to ask Dr. Harper some questions, and I mentioned to her they would be off the cuff and coming from the participants tonight. And so we will try to answer as many questions as we can. This is, of course, a very heavy topic. So I want to let everyone know ahead of time, we may not get to all of the questions. But what we will do is if you will put them in the chat, we will make sure that we write them down and I can be in conversation with Dr. Harper and find a way to make sure we share this with our participants. So I don't want anyone to be discouraged if your question isn't answered, but I think because this is such a huge topic, there's a lot to unpack.
Yeah.
She covered in 20 minutes something that people spend 30 years researching and writing about. And as a PhD English professor, and of course, you know, with my studies in history, I understand the work that goes into putting these sort of presentations together. So thank you, for doing this, for helping us to educate our community. That is why it's called community class. So the first question that I want to ask you, Dr. Harper, because you specialize in language and words, and you talked about the importance of understanding phrases and words. And so if we're going to go in a kind of a chronological sort of fashion here, you talked about people being defined as imbeciles and being defined as feeble-minded. And as someone who thought about the 19th century, particularly antebellum period, what it meant to be sound, because that was a term that's been used a lot, particularly in antebellum literature, the importance of soundness and you know, being alert. Can you talk about what sort of tests or trials or parameters were used to determine if a person was sound or capable of making decisions, or if a person was not, and how the institutions or the powers that be decided who was a candidate for sterilization?
You know, really, there wasn't like a test per se. It was more like behavior. So if you got into trouble a lot, like you were a delinquent kid and you were constantly getting into trouble, social workers would possibly label you as a candidate for sterilization. If you had like I mentioned earlier, participating in premarital sex, or and this is really unfortunate for women too, because women bear the brunt of premarital, you know, sex, right? So if you get pregnant, everybody knows that you had sex, but a man can walk away. And because of that, that behavior is now identified, and now you're a candidate, right? So it really wasn't like, okay, you have to take a test per se. It was more them looking at your behavior. And also keep in mind that many of the people who were sterilized were already in mental institutions or were part of the penal system. And so a modicum of their rights had already been removed. So that played a role in sterilization. Now, just pivoting a little bit, if we think about chattel slavery and the idea of soundness, physically, women's bodies were actually, well, men too, they were, their genitalia groped and checked in order to see if they were able to reproduce. So that's another way of seeing if somebody was able to actually provide value to this chattel slavery system. But definitely looking at behaviors. And even here, like recently with the women who were held in detention, right, where we hear stories of them being sterilized and they didn't know. So it wasn't necessarily a test. It was more of a doctor making a decision based off their own assumptions about, should this person recreate? You're quote unquote here illegally, you're having a medical issue, we're going to go ahead and remove your reproductive organs at the same time. You know, so it's really decision making that rests in the hands of a few individuals.
Thank you. Several people in the chat were asking about statistics, particularly from 1946 to 1968, in terms of sterilization in North Carolina specifically, and you highlighted Mecklenburg County. So the question was, do we have any information, or do we know why that was such a hotbed in terms of the numbers for Mecklenburg County, or that particular part of the state?
You know, unfortunately, I don't have an answer to that. I'm sure there's one out there. I know with Dr. Price's article, they talked and it might have something to do with poverty in that area. And so maybe there was more poverty, but I can't really speak specifically to why Mecklenburg County had a higher rate than other counties in North Carolina.
Okay. The questions were also being asked about um, specific demographics. Do we have any numbers? So for example, you mentioned that we talked about particularly being a class issue.
Mm-hmm.
So this isn't just about Black women being sterilized, but we talked about class in terms of poor white people or folks who is perceived to be inferior for whatever reason, whether it was class or where they originated. But do we have specific data to organize it based on age, race, or location?
You know, there is information. If you go to the North Carolina Justice for Sterilization Victim Foundation, they have a lot of data that you can find there. Now, the fund was established, I believe, in 2014. No, 2010. And then the fund started paying out in like 2014 and 2015. But the data did show that Black women were sterilized at a higher rate than other women. Well, Black and Native women. And there's also the Winston-Salem Journal did a in-depth expose that covered a lot of statistics about eugenics in our state. And they were actually instrumental in moving that legislation along as well.
So Dr. Harper, I'm going to ask you to repeat both of those sources again.
Sure. Okay.
That's in the chat. So if you were that one more time.
Okay, it's the North Carolina Office of Justice for Sterilization Victims.
Mm-hmm.
Okay, and then the Winston-Salem Journal, they had a study on sterilization in North Carolina. Okay. And you can just type that in, it'll pull it up. Or eugenics in North Carolina.
Okay, so we want to make sure we get that information down to help people, take some time and do some of their own research. Again, because it's such a heavy topic. And one of our museum educators has just listed to panelists and attendees some specific dates. And of course, Dr. Harper, she could do a whole course on this. But some specific dates regarding eugenics, 1919, 1929, and of course, 1933. As it relates specifically to North Carolinians. And I think you may have mentioned this, Dr. Harper, but we're looking at a system that was in place well into the 70s.
Yes.
And I think that's the part that blows people's minds in terms of sterilization and women being prohibited in that way, because we think about this as something that happened so long ago. And it's so hard for people to make the contemporary connections. How did these events affect us today, and why should we be well versed in this particular part of history? She also goes on to note that in some parts of the 60s, you see in some places more whites sterilized, but again, we go back to this whole notion of who is feeble-minded, who is found, and also dealing with location. The next question I have for you is, in doing this research, you talked about your own personal experiences as a mother. You talked about the importance of Black families checking in on each other. And this whole notion of, I think a lot of folks have been told at some point in their life, if they're not feeling well, just go take a nap, right? Sometimes maybe that's what we needed to do, But my question for you is, what particular body of work influenced you the most in terms of doing this research? I know there are 3 works that come to my mind when I think about this sort of work in terms of Black women, particularly from the antebellum period on to the contemporary times. But was there any article or book that just motivated you or made you feel like this is something that's shocking, something that is relevant, that speaks to me, and I want to move forward with it? What are your recommendations for reading?
What happened, I read something by Chester M. Pierce, and he talked about racial microaggressions. And I was just like, oh, so I'm not like making it up in my mind. When I went with my baby to get some assistance and the woman wouldn't let me into the building, you know, it was a racial microaggression. And so Chester M. Pierce is a wonderful resource for looking at microaggressions in our country and how those play out in racial dynamics. I also, this book right here, Body and Soul, the Black Panther Party and the Fight Against Medical Discrimination by Alondra Nelson is, I don't know if y'all can see that, an excellent, excellent resource. Harriet Washington, Medical Apartheid. She blows it wide open about all the experimental testing that happened to Black people in this country. Dorothy Roberts, Killing the Black Body is an excellent resource for looking at the history of contraceptives in this country and the way in which it's used against poor women. You know, she talks about Depo-Provera, she talks about Norplant, she talks about how these were tested and rolled out in Black communities, how when women were complaining of symptoms and they went to get it back, you know, get it taken out, then the doctors were like, no, you're gonna have to pay. So she's a good resource. Audre Lorde, in her writings about motherhood, the cancer journals that she did, excellent resource. Anything by Loretta Ross, like I said, she's a huge reproductive justice activist, and Ricky Solinger as well. I mean, it's just a lot of, Adrienne Rich has written a lot about motherhood, theory of motherhood. Patricia Hill Collins, Black Feminist Thought. It's just Black women and the scholarship that's out there about motherhood and community and this idea of fictive kin, and how we raise our children and raise each other up. Yeah, but my two go-tos are Harriet Washington, Alondra Nelson. Well, not two, my three, and Dorothy Roberts.
Thank you for that. And certainly have our museum educators taking some notes on that. And I want to do a shout out to Michelle Carr for those dates regarding eugenics in North Carolina. So thank you, Michelle. This has gone by really fast. I want to ask a couple of more questions. Okay. And I want to speak to one question that I receive every time we have a program that deals particularly with underrepresented communities. I think maybe I should do, or we should do, a program on race. Simply because for community class, it's about educating all North Carolinians, regardless of your race, your gender, your background, or your class. Because the more we talk to each other and learn about our shared past and our specific individual past, I think we can learn more about each other. So I want to say that we talk about race because race is real, and it is a social construct. So inevitably, for every program, someone asks, why do we talk about race? We are the human race. And I want to say race is real. Want to go on the record about that. And that our experiences are different because of our backgrounds, our class, our race, and our gender. And we want to make sure we educate folks on that. So I wanted to get that particular question out of the way. The next thing I wanted to ask you was, someone mentioned, and I know that that floating question was about Mecklenburg County, but we know Charlotte is close to South Carolina, right? And then we think about the gentleman who is labeled as the father of gynecology. And I think, yes, Sims. And wondering if there's any connection there, and wondering, Dr. Harper, if you have any thoughts or commentary about the history of gynecology and its connection to this topic tonight.
Yeah, I think the field of gynecology owes a debt to Black women. Enslaved Black women were tested on, and often, well, not often, but without any type of anesthesia, and it was available some form during that time period. They were subjected to, test after test after test, as he was trying to figure out how to repair a fistula problem in the body. And so because of those tests, it laid a foundation for the lack of consent. Now, they were considered chattels, so they could not consent. Their owners gave consent. But what ultimately happened, in my opinion, is that it laid the foundation for consent when we were free, never to even be considered. So you see the story of Henrietta Lacks. You hear about women who go in for one procedure. I'm thinking of Fannie Lou Hamer, and she has a full hysterectomy unbeknownst to her. You hear about the way something was written, and because somebody was illiterate or didn't have a level of literacy for understanding that medical language, that they give consent and they really don't understand. So as a medical professional, it's unfair to say, I read it to you, you signed it, but did the person truly understand? Because often when we go into those medical spaces, you already feel like you don't know, and you're trusting this professional to be the expert who's going to guide you. So if that expert misleads you or doesn't make sure you fully understand, then they've done you a disservice. So I really think J. Marion Sims laid the foundation for the consent issues that we have in our communities. When we think about testing with certain contraceptives, again, people were not told exactly what would happen. So I don't think he should be lauded as the father of modern day gynecology. A lot of the experiments led to, breakthroughs, if you will, but at what cost? Those women should be considered the founders of modern day gynecology. I think the one enslaved woman's name was, I can't recall them at the moment, but.
and that in itself is another program too, Dr. Harper, but I just wanted to mention that and try to make the connection. I've seen where several people have talked about Mecklenburg County, and I want to make sure I'm saying this, Wallace Carrault, I want to make sure I'm saying that correctly. I'm thinking about the head of the Mecklenburg County Welfare Program from 1945 to 1972. Dr. Johnson is on with us tonight and has mentioned that along with some other panelists. So we want to make sure we make a list of those references as well in terms of the women who were referred to the Eugenics Board in various North Carolina counties. So we've got a couple of minutes left. I wanted to ask you, I want to jump back to a language question for you, Dr. Harper. You talked about the importance of terms and phrases that push back marginalizing folks and empowering people. Can you give some examples of some of those contemporary phrases, or you can use some historical ones that disenfranchise people in terms of access to medical care and the things that they need, or the sort of words or phrases that empowers people?
I have a colleague and she mentions this idea of someone being non-compliant. And she's a nurse educator, and she said it always strikes her as people aren't just non-compliant. They just don't decide not to follow a doctor's orders. Oftentimes it's because of a lack of access to a resource that they need. And so that would be an example of moving away from, so rather than saying someone's non-compliant, finding out why they were not able to comply with a doctor's orders. And education has a big shift to move away from this deficit language. So when you see children are at risk, or we are communities that are at risk, people are replacing that with at promise. I know, particularly with Black mothers, in terms of the visual connecting with the language, we hear, like I mentioned earlier, like the term baby mama. Well, I didn't mention that, but terms like baby mama and, welfare queen, those become part of the lexicon, and politicians use that and then co-opt it to say, well, she's a welfare mom, so they don't deserve resources for school or community parks and things like that. So I think we have to begin to really call people what they are. And if you're a mom, you're a mom, not a baby mom, and you're not a a welfare queen, So I just think there's a lot of language out there that we use casually that really has a detrimental effect on how we see ourselves.
Right. Well, this has gone by really fast, and there are a few other questions, but what we're going to try to do is pull something together to make sure we can maybe pull together some sort of summary or synopsis to try to answer some of these questions. Dr. Harper, thank you so much for joining us tonight. I want to remind everyone to look in the chat to make sure, follow her on Twitter, pay attention to some of the programs that she mentioned at North Carolina A&T. I also want to make a couple of announcements. But before I do that, Dr. Harper, do you have any last a summation or any last words that you'd like to share before I give a few more announcements?
No, I just want to encourage everybody to remember that your words have power, and that we should be kind to each other, especially, COVID has brought us kind of back to the center and taken away that opportunity to be with friends and family in meaningful settings. So just remember that your words matter, and they can affect change in your lives. And we have to use that language to affect change in our social systems. Thank you for having me. And thank you to the audience.
Yes, thank you to everyone who has joined us tonight. Again, this is a new series. This is our third program. And I want to ask you all to continue to look at the Museum of History's website. We've had some phenomenal programs recently across the spectrum. We just had a program on the Revolutionary War and the importance of understanding the revolution. I had a program about the freedmen's villages in North Carolina. So continue to look at our website, because we have a plethora of programs that we're offering virtually that we would love for you to join us in participating and having conversation. So we hope you enjoyed this program. We've recorded this session and we invite you to view our previous classes and also all the other awesome topics that we've covered over the past few months. We are very grateful for your attendance. We also want to ask you to continue to support the museum further. We have several ways you can do that. The museum's Friends Group, you can donate to the North Carolina Museum of History Foundation. You can support our museum shop. And it's important to do that, to participate so that we can keep these sort of programs free. Want to do a quick plug for our next community class program. Of course, Dr. Harper mentioned that we're making this segue into Women's History Month, and we have slated Dr. Martha Jones for Women's History Month at the end of March, author of Vanguard and Birthright Citizens. So we're going to ask that you continue to look to us for your historical entertainment, learning, and needs. And again, Dr. Harper, we cannot thank you enough for joining us tonight and for giving us this really important education and for making the connections regarding our past and our contemporary issues and giving us a light to shine on how we can improve our futures. Thank you everyone for joining us. This will be recorded again and placed on our YouTube channel. Have an awesome weekend and please stay safe.
All right, take care.
Bye-bye.